We're live right now. Here, let me skip over
Hi,
to our
everyone.
incredible image. Oh yeah, here we are. Here's the
Hi,
image.
everyone.
You guys, we actually have some new images. Look at this. Look at this. This is going to be
Oh
our
my
new
God.
transition screen. Oh my
Oh,
God, so much
it's
America.
so good.
Well,
It's so
all right,
good.
so
I love it.
we're gonna start off here. We're gonna show you all our amazing guests this afternoon on this wonderful Friday, pre-holiday Friday. It's gonna be like
Oh,
it's gonna. I feel like this is gonna be an intense show. And like I said, it could be our best show or our worst show. I'm here for it. We're gonna. Okay, so just so everybody knows, we have been told to not bring up the fact that Jonathan Bush is on his boat, but here he is on his
obviously on a
boat.
boat. Obviously on a
and
boat. Where else
and
could he
Don
be?
and Dr. Don Ruckler is joining us live from Crystal City, Virginia. It's in Virginia, right? Yeah. And he
Yeah.
actually doesn't have power, so he is like pulled together some emergency services to make it on this show. So, all right. So
Just
we're
like,
actually
just
like
like,
we're
just
not
like in the beating heart of the United States government, and there is no power.
yeah,
What does that tell you?
just like
Let
this.
me ask you that.
This
It's
is
hard to be
Don.
a Beltway bandit.
Hard to be a Beltway bandit
Okay.
with no power. I
All right.
gotcha.
I feel like we already started the show off on the wrong foot. So okay, we're gonna do our Kat and Lisa normal news show, which I pulled together approximately 25 minutes ago. Here's Lisa. Here's me. Amazing. We're ready. Lisa, would you like to tell everyone about your amazing vacation experience or not?
Oh my God. No, I mean I've obviously been away for a little while. Had a fully week off with no internet, no phone, no Cat McDavitt, which was very upsetting for
I
both
don't
of
know
us
what's
for sure.
happening. It
And
was,
just
except
got
you might.
got some feelings, sent some feelings out into the universe. It was amazing. I came back and I think I've decided that I've changed and no one else has, so who cares?
Yeah.
Basically.
I feel that way. Well,
Right?
I don't take vacations, and the only 2 days out of the year I don't work are Memorial Day and the 4th of July. So this Monday I
Coming
will
right
not
up.
work very much. Here we go.
Coming
There we
right
go.
up.
All right.
Monday.
I know it's totally
Right?
happening, so I might not work. So, all
Woo.
right, so here's our news show. We got, like I said, Lisa, I pulled this off of our Slack channel a few minutes ago. So, but there was
Wow.
okay. So, did you all see this like pretty amazingly damning Oracle
Yikes.
article about like, wow, Cerner was a dumpster fire and they bought them, and then they said that they were gonna save American healthcare. Like, what do you think about that?
This hurts. This hurts. I mean, this is just such a bummer because, these companies had such potential to really maintain. I know we're going to talk about the free market in healthcare. Well, here's a great
God
example.
bless America.
You know what you need? You know what you need? No matter how great Epic is, you need competition to create a truly free market and have there be great opportunities for better services, better products. Well, this was a real opportunity, and I feel like this pretty well researched article means that it has been missed a little bit, and that's sad. Healthcare is hard. Healthcare is hard.
Healthcare is hard. I feel like the free markets would work if we didn't like have bad regulations on top of it. Right? I don't know, Lisa. Like, what do you think about
You
that? I don't
need
know. I don't
competition.
know.
Even I know that. Even I know that you
I
need
don't
competition.
know.
Come
Yeah,
on.
yeah. So that's who knows? Maybe Veradigm will come back, Lisa, and they'll take over Oracle's void. I don't know. Probably not. Speaking of Veradigm,
We
I
could
have them
use some
in
new
a little bit up
leaders.
there.
We could
Yeah,
speaking of, we could use some new leaders. We could use some new leaders.
we could. But let's talk about people dying from the opioid epidemic. Speaking of, so like, okay, so there was a recent news article. There was some news maybe what, 2 weeks ago saying, oh, opioid deaths have actually dropped. Oh, but heroin and fentanyl overdoses have gone crazy. And like I recognize why we're like making them separate, but also like, is that really a news story that more people are just taking this like street drugs? Like, anyway, this is actually a really, really sad article about
It's really,
Baltimore.
really
I know
sad.
this is a thing that
Yeah,
hits
those
your
of
heart
you who
as a
may not
former
know
resident.
all the lore of Lisa Berry that I lived in Baltimore for 7 years, partially while working for CMS, and lived in Baltimore City. Also, my family are from Baltimore City. My grandfather was a diamond setter who had a little workshop down in downtown Baltimore, right? So I have at least a little bit of a special place in my heart for Baltimore. And this is just so freaking sad. Talk about a place that needs better leaders. Baltimore deserves better leaders in the city, in the county, in the region. This is so messed up. Like Baltimore has suffered enough. They just got a little bit of headroom on gun deaths. Like they literally just started to see gun deaths dropping a little bit. And then the other side of that is, and everyone is dying of overdose. Perfect, wonderful, great.
Yeah,
Baltimore
not the
deserves
best.
better leaders. This sucks.
Yeah, you know what we also deserve nationwide? Better access and sharing of sensitive information outside of PDMPs, which is one hell of a story of regulatory capture. OMG. Okay, moving on. So
I
speaking of
agree.
opioids, Lisa, I did want to
Ooh,
include this amazing story about your
ooh.
favorite company, formerly known as Practice Fusion, now known as Veradigm. And I saw this and I was like, yeah, fuck those guys. And you were like, actually, the story here is that this was a lower level salesperson that got scapegoated. Tell
Yeah.
us more about this
We,
story from the inside,
yeah.
as you were beyond your
Yeah.
quiet period.
Never had one, never had a quiet period, amazingly. And luckily for me, not luckily for all of my colleagues and all the people who were affected by this happened after I left Practice Fusion. But this guy, Steve Mack, he was the national like account director, and he was the one whose name was on all of the deals with Purdue, where they did a level of clinical decision support, pushing doctors to prescribe extended release opioids in a way that was determined to be illegal. And more than that, they also destroyed evidence, as you know, from many nationally kind of big in the national news cases. Like trying to like destroy evidence and hinder an FBI investigation is real bad. Like you can make it
Weird.
worse. You can make it worse. The crime, and then there's the cover up. The cover up could be worse than the crime. In this case, this guy, his name was on all of those things. He's the one who deleted some documents from his computer related to this. And so that's what he was got on. And then you say, okay, he was cooperating. Obviously, it would be very foolish not to. So where are the other charges? Where are the charges for the leadership people who were in the positions to make these decisions? Those seem to never have happened. Did the government just not have a good enough case? I don't know. But I have questions, as do many people who used to work for Practice Fusion. I
Yeah,
got some questions.
yeah, yeah. Yeah, I think we've all got a few questions here and there about these guys. So anyway, look forward to seeing their continued success in their new iteration of whatever paradigm. Okay, hey, yeah, let's Lisa. Do you know I don't like
We
Medicare Advantage?
we kept we are the reason we destroyed Medicare Advantage. I feel like we did it.
Take it down with our internet
We
talk
took
show
down
fake
Medicare
news.
Advantage. No, we didn't do it. We're not that. We don't have that big of heads. But like honestly,
I don't think we
very
did.
entertaining. It's very like it is really like you just see these bubbles growing and you can kind of track them. And again, like I don't know if your business, like if your plan is to make a huge margin off a government program, it's not going to work forever. I guess people made a lot of money while it lasted. I don't know.
Yeah, I think they might make more money again though.
Yeah.
Like, these people are all going to die, Lisa. Like, they're all going to die, and then we'll have newer people, and it'll be less
We
expensive.
are all, you know what you can say? We are all going to die. All of us are
We're all
going to
going to
die
die.
not too long from
It's
now. And
guaranteed.
we should try to do less shitty things while we're alive. That's my summary.
You know
Like,
what?
let's try and
I
do
think
like,
that's a good point. We should do less shitty things while we're alive. Like I was gonna include the McKinsey thing in here with how apparently they're telling China how to destroy the United States of America. Like again, like I feel like we should all just make better decisions while we're alive.
make better decisions while we're alive.
Yeah,
We're not
yeah,
alive for that
yeah,
long. Let's do less shitty things. All of
yeah,
you,
yeah.
all y'all.
Yeah. And listen, y'all, the almighty dollar is something that I'm into. I enjoy chasing it all the time. However, sometimes you should not chase the almighty dollar if it means telling China how to destroy America. I don't know. 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 Moving on, moving on. Okay.
Short-sighted.
Oh, so I wanted to bring this up because we had our friend Jennifer on the show a couple weeks ago, right? And she was like, basically, we're crushing it. We're kicking out this shitty UNOS organ transplantation system. HRSA's
Wow.
they got their RFP out, right? I think we actually like posted it in our show notes. We actually found it, and that was great. And then this article came out in Politico. The headline, the headline was like side
Headline
eyeing
is
the Oregon
amazing.
overhaul, and I was
Amazing.
like, WTF? Because these are the same senators who said that they were the ones who helped like get it done. But really, all they're saying is here is like, we're watching HRSA so they don't give UNOS the contract again, right? And it's this whole thing. So another point about reading headlines maybe not being the
Listen,
best thing on the planet.
Chuck Grassley, you could say all kinds of things about Chuck Grassley, but that guy knows how to hold a grudge and like is not planning on leaving till he gets stuff done that he wants to get done. And I gotta like all politics aside, I gotta be like appreciate a man who can hold a grudge. I can too. Honestly, he is committed. He is a
He is
committed
committed.
person.
He is committed. I wish I knew how to screenshot more things and fit them on the screen than I do right now. But there are some great quotes in there about how he's basically like sticking.
I also love a curmudgeon. Like he's just a curmudgeon, man. He's not. He's not. He's the kind of guy who's just going to do something unexpected at the last minute, which I also appreciate. Good job, Chuck.
Well, we'll see. We'll see what happens. Oh yeah, this one too. This one we got apparently the feds are all like, whoa, not so fast on doing all the shrooms, y'all. This was
if
another
only
one
we had known. Oh man.
Yeah.
If
No,
only
but y'all like. This is another one where you have to actually read past the headline. Like she's actually pretty, like it's a pretty moderate stance. Like, hey, like we don't have all the research. Like maybe don't just go do a bunch of mushrooms.
Totally true. Absolutely true. True statement.
Or it wasn't just mushrooms, MDMA, all those things. So yeah, it's basically like there's things are promising, but my favorite line from anyone is we need more research. So that was in here too. Absolutely. Yay, amazing. So I put this up. I like this image. I was trying to find a dumpster fire, but then I thought the national network situation was more like this than a dumpster fire, because a dumpster fire would imply that it's contained, and it appears that it is not. So we were, you were out on vacation, and then we did that thing in Miami last week, and we didn't get to comment on our friend Brendan Keeler's amazing post calling out care quality for being even less transparent now than they used to be. So yeah, I just feel like things aren't great there. Everybody's kind of freaking out that things are going to blow up.
If you know our background, our collective backgrounds, right? We did some PR work early in our career, and one of the things about PR, like one of the things you have to learn pretty quickly is like crisis management, right? Crisis management. Shout out to crisis management. Here's what you can get wrong. When your reaction is to become less transparent and like close down and delete things and remove them, that's a bad direction to go. Like it pretty much never ends up in a better place than when you started. So my unsolicited free advice from a XXXXX PR girl is to say,
former Practice Fusion. Speaking of crisis management.
I was not in PR for them, thank God. But what I will say is, please try to be as transparent as possible. Don't delete things. Don't hide them. Don't take them off the website. Don't do the thing where you're like, oh crap. The more transparent you can be, the better it's going to be. You got to be open and upfront and honest. And that's the direction to go. That's some free advice from me to me.
Okay. To add on to that, friend of the show, best friend, Michael Marchand says, you just said the cover up is almost worse than the actual infraction. Almost always worse.
It is. It always is. It always is.
It's true. Oh my God. Anyway. So like whatever. We'll ask one of our guests about that, and I'm pretty sure he's going to tell us what he thinks. So that's fine. And then last announcement is, as you may have seen, the Health Tech Talk Show is covering Health Europe. It's going to be crazy. So come with us. Apparently, there's like a black tie event out there. Like it's not like one of the health US parties where you just show up looking like a schmuck. You have to actually like do your hair to go to the Health Europe reception. So we're doing it.
That's weird.
We're doing it. All right. Well, let me do the transition slide, and then I think we're gonna pull Don up so his battery doesn't die, and also because I want him to comment on my picture of the whatchamahell coming out, like digging itself out of the hole. The I don't even know what it's called.
The
The
digger.
backhoe. I don't know. What is it?
The backhoe, the digger. I don't know.
Welcome, Dr. Don Rucker, who is our former national coordinator, and I'm not allowed to say what I really think about that. And then also Chief Strategy Officer of What Up Health. Welcome. This is your second appearance. This is your first appearance on the real show. What do you think? How is it? How is it going?
Oh, okay, great, thanks. You fooled me the last time around. That just went into the blind ether, I guess. Or
no, that one was real. But this is
you were on the show.
Yeah, Don, we even pulled out the snippet of you telling me that my information blocking rule of was like NutraSweet on my ice cream. That was like a big hit. Like a lot of people thought that was funny.
We attempt to entertain, don't we all?
Yeah. So what the heck's going on?
Well, there's a lot of stuff going on. What do you want to talk about? APIs, Kefka, dumpster fires and networks.
Well, do you think Kefka is a dumpster fire?
It's on the road.
On the road, on the dumpster fire road, the road where there's like, it's like the Mad Max road where there's like Mad Max stuff happening and like flames shooting out, or like, what are we talking about here?
Yeah. I don't know if Mickey's Mel Gibson. We'll have to leave that for further analysis. No, but
Cat is Furiosa, though, right? Like Cat is Furiosa.
Yeah.
Right? If we're going with this,
I don't know.
It's been a while since I've watched those movies, like many.
Oh my god.
My memory there is weak. I think the challenge is you're using ancient tech standards when you could use modern standards. They don't allow you to really compute about the data. You can't graft fire.
Oh, this is like when I went.
And
this is
and then you have the issue. Yeah, then you have the issue. It's wildly anti-competitive because it, essentially doesn't work with a modern digital economy, right? Everything on your smartphone type of thing uses modern APIs and RESTful, and this is a 20-year-old standard. And then the thing that's probably going to electricity has just come back in my building in this last second. Amen. But the probably the biggest issue is going to be, and this is what I think care quality is, that you alluded to, is struggling with, which is the interesting thing that in 2024, attestation and trust in you really should believe me is sort of a fool's errand. You need modern public key cryptography and authentication services and granular permissions. The world where trust worked in the networks back when all of the counterparties in Commonwealth, let's say, or even some of the places where you guys have worked, were licensed doctors, nurses, and hospitals, and pharmacists who had very explicit, very publicly discoverable licenses. When you get into amorphous networks, and their HIPAA works fine, right? You presumably know who your doctor is in most cases, unless you're comatose. You know who your doctors were. So if the two are sharing, you sort of know that. You presume know who's paying for your health care. And so the endpoints. It's when you get to these amorphous things where you have the QHIN layer and the participant layer and the sub-participant layer and some other layers, and you don't know who's talking to whom. There's no permissioning. The only audit trail is a trail in retrospect. There's no prospective permissions. That's probably not really going to work. I mean, it isn't like we haven't had Change Healthcare and Ascension to give us some fairly recent guidance on that there are people attacking American healthcare. So, I guess that's probably enough said there. Sort of speaks for itself. What's the medical malpractice phrase? Res ipsa locator. The thing speaks for itself. You don't want to hear that at the trial, say just parenthetically, because that couldn't be good for the outcome. You're being sued, but it's out there.
Okay, hey Don, I want you to
Yeah.
I have a question for you. So I think you cut out a little bit. You said in the beginning, like basically you can't
Right.
just like slap on fire over the bad Tefka stuff, the old timey data exchange standards.
Yeah.
A lot of people. So when I say like like because like I do these big data deals and
Yeah.
the Tefka is just like not ideal for the type of like mass things that I have going on. And a lot of that data already flows, and that's one of the reasons I love information blocking, even though you don't like it, whatever. But whenever I bring this up, and I'm like, it's not going to
I
work.
like
Public health needs like mass data sets. They
I
go,
like the
bulk
information blocking
fire. They
rule.
said, cut.
I wrote it.
Okay, well, okay. Well, you told me it was like NutraSweet, and I don't do NutraSweet. But yeah, like people tell me they're like, cat,
Um,
it's gonna be fine. Fire, bulk fire. Like, tell me what? Can you please tell me if that's bullshit? Because I just go like, huh?
um, so okay. So bulk fire, yeah, I was involved in that. I probably should have named it something else. This was a Ken Mandel concoction that ONC
It totally
funded.
was.
I'm totally behind it. And the theory is pretty simple, which is if we're going to standardize the data for APIs, right, under the Cures Act, let's do it so we actually have a fighting chance to look at population health and compare when payers and providers can have a population level of what they're doing, because the individual stuff is an N of one. I was just shocked when I found out from Ken that this whole fire apparatus didn't allow a query to return more than one record. Um, how could that possibly be a modern thing, right? It's just so beyond the pale. You still need these things are not on demand.
I feel like the feds know that Don's talking to us.
The
And that's
To
feds are
have
cutting
come
them off. They're
together
like,
and have a shared legal contract to say this is what we're going to share and when. Um, and so, um, while it's the same payload as the individual access APIs, the permissioning is totally different. So for the audience, just keep that huge distinction in mind. Obviously, there's a hope that there'll be more and more of this, and in fact, that's what we're seeing. I mean, there's actually been um, a lot of folks on the payer side, on the provider side, who are starting to do stuff with bulk fire. I think it's actually worked out um, quite well for what it is, which is quite early. So yeah, we need transparency in healthcare. It's going to come in many places. It should come in many places. This is a big one. If we can't, we've had a zillion discussions in America about value in healthcare, right? We've been talking about this since for the last 20 years at least, if not longer. Value is not calculable if you don't know the price of something and what you're getting. This is like shopping
I
101.
agree. I agree.
It's shopping 101. We sort of know what the prices are on some level. That could be argued. But the what we don't have really is what are we getting? And that's where bulk fire comes in.
Yeah,
all
definitely.
right, all right.
I always have to laugh about how many things you and I agree on, Don. Most unlikely pairing in history, but we are alike in many ways. In many ways, I agree. Oh, maybe that's me and Kat. Oh,
Yeah.
Kat and I also have plenty of things in common, but whatever.
Well, yeah,
We got Kat.
yeah. But there's many things we don't agree on. There's many things that I feel like we agree on. Just like we were fighting about something recently with one of our friends. Anyway, we won't bring that up here because it'll make me mad. Okay, but Don. Okay, so say Tepka is like total trash, like it doesn't work, it blows up. It's the dumpster
Well,
fire becomes a real fire.
it may, TEFCA may work for the limited cases where you need
Right.
an entire record, right? So if TEFCA is, I
I
think,
agree.
I mean, maybe not the QHINs and all of that, which should actually be done by CMS and directory services, so we don't have all of these brokers and intermediaries. That's a whole other thing. But the concept of exchanging a CCD, I think it makes total sense for some security.
knows?
Disagree.
It just doesn't want to impact digital healthcare in a competitive environment. So there's a bit of a big nuance there.
So what do
Probably
you
also
say?
doesn't make sense for
What do you say about
populations.
the
That might
like?
be
What's your response then to like, well, we're fixing it, right? We have, facilitated fire, and we're gonna do it. It's in the Common Agreement Fee 2.0. Like, what's your answer to that? The whole structure is still problematic.
you should read you should read their Fire 2.0
Oh,
spec
I have.
and take it to anybody you know who knows how an API works and ask them how they're going to get individual data fields through that. That would be my recommendation.
So Don, so would you agree with how Lisa and I feel about health data exchanges? That we need many avenues to health data exchange, not one. Would you agree with
Many.
that statement? Like, would you feel like how do you think? What do you think? I don't know.
The reason I got to love HIEs, health data exchanges, health data utilities, is as much as I'm a total free market guy, this kind of stuff needs robust governance. It just does. In our current system where we don't actually have control of our payments and control over our healthcare. I mean, the brutal reality is if you're in America, unless you're extraordinarily wealthy, you do not have the ability to fully provision your own healthcare. And even if you have that, I mean, I know friends have made a living brokering that, you don't really have it. So in our world, we need somebody with public governance and public accountability to do it. And HIEs have done a great job in doing that. I mean, geez, I wish CDC would like wake up and smell the roses and realize most of what they couldn't find at all during COVID was available in state after state after state.
Oh man,
Any
I feel like
HIE,
Don's.
especially one that really.
Yeah. Oh, Don, sorry, your internet's a little
You're
spotty
you're
there.
you're
Yeah,
We got some
sorry.
good stuff though. We got some great
Yeah,
stuff
but
here.
don't
Just
you
keep
think?
keep
Yeah, I
going.
mean, it's really powerful. And we need more of that. Like, why do we have separate immunization registries, right? Like, what part of clinical medicine said that some of your immunization should be kept in a different part than the rest of your medical record? I missed that day in med school. Now I cut a bunch of classes, so quite possible that that is all on me. But I'm sort of a curious guy. I try to keep up with things, and I haven't heard the explanation anytime in the 40 years since med school either. So I'm still waiting.
Do you know,
Yeah.
Don? You
So
know what they call? Do you know what they call the doctor who graduated at the bottom of his class?
Yes, Dr. Rucker. No,
Doctor. Doctor. They call him doctor.
So, okay, here's my issue with the HIEs, and like, listen, everybody knows a lot of HIEs pay me money, right? So there's a couple things. Like, one is like, yeah, like there's a lot of complaining out there in the market, like, wah, our DERSAs don't work with whatever the hell everybody needs us to do. And my thing is like, well, then like, fucking change your DERSA, like, go do that, like, because guess what? A lot of the good HIEs have done that. So it's just like this whiny, complaining bullshit. And so I'm either waiting for them to wake up and do that or to die so that the other HIEs can just expand and take them over and then fix things. Either of these opportunities would be great. But the other thing is like, so when all this, the dumpster fire in the national networks, which appears to be expanding into a forest fire, when all that happened, Lisa, some of the bigger HIEs were like, packs like, oh, that would never happen with us because we actually have controls and governance, right? And it was like, and I was like, yeah, you should flaunt that a little bit. That's pretty impressive. So yeah, I think that and I hope some lessons are learned here, but I'm not sure that any will be. So I don't know.
I mean,
We'll see.
I 100% really, really want there to be more data exchange. There is a role for national networks. There is a role for health data utilities. By the way, Don, we haven't talked about this, but you just can easily see the way the Fediverse is developing in social media as a perfectly meaningful, useful corollary, useful point of reference for how health data utilities could develop across, are developing, could further develop, could be thought about by the federal government, by national players, right? It's the Fediverse, but for health data. There you go. And like that we need that. We also need national networks. We need all of those things. But you don't want Meta to be in charge of all of your, just like people are saying, hey, it's kind of weird that Meta owns all of my social data. Maybe I should do something about that. Yeah, maybe you should. Maybe you should be the one who owns that record, owns your data, owns what happens to it. Maybe it should be something that's more local and not something that is as national, only relying on a national player. It's the same thing. Perfectly the same thing. Going to write it up at some point.
Yeah, I mean, I think the understrate of the substrate of all of this stuff is, you know, modern computing, right? We don't need 1990s document exchange, right? This is not AOL or Yahoo anymore, right? We need modern computing and modern APIs and modern security. And then where the pieces fall with that is up to people's creativities, passions, whatever we have in markets and healthcare. Um, but, the answer is not to go back to the 1990s and double down through policy on document exchange without
That's what I'm
privacy.
talking about. Yeah, yeah. Hey, Don,
Totally.
what do you think
Well,
of?
I know
What do you
somebody,
think?
and I know a guy who's willing to break it up.
Yeah. But hey, Don, I have a question. What do you think of AI?
Um, I'm I'm a big fan of it. I was actually a grad student at Stanford in the AI lab in the '80s. We were one of the five. We were one of the Ted Shortleff, who was my master's project advisor. We were one of the five AI groups in Ed Feigenbaum's Knowledge Systems Lab group, and was called the Stanford AI groups that were affiliated. The reality is rules back then weren't robust enough to work. I think neural networks today and the amazing stuff that's gone on is huge. It's going to do all kinds of stuff. I think I don't know that you can
Wah,
regulate
wah.
being used is I think a starting point um, on this, and even that's probably not really regulatable. But um, I think the algorithms are sort of too complex. The other thing that's very interesting for the audience is this retrieval augmented generation. So everybody's for the last 2 years talked about Chat GPT, blah 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 blah. But the real win here, building on the Google paper, right? Attention is all you need back in 2018 or whenever it was, is these things that blend highly structured knowledge bases um, through vector databases with these big prompt engines. That's folks have curiosity. It sort of goes under the somewhat uh, you know odd acronym of RAG, retrieval augmented generation, but folks
Cool.
should pay attention. That's what most of this is going to end up being, as much as we can say that in end of May 2024. Maybe next month will be
Um,
something totally different.
so remember that, loyal fans. RAG is the future. Remember. All right. Okay. Hey. Also, Don, what do you think about PDMPs?
Um, I think it's another toll taking operation. I mean, I don't mind them. I think it would be better if we had coherent medical records to begin with, like from an HIE, as opposed to another point source of data that screws up my workflow when I have to go as an ER doc and try to look something up, right? Wouldn't I rather look all of it up in one spot rather than
That's what I'm
looking up
talking about.
in here with one set of passwords? Um, yeah, it's also I think the word that you guys used, regulatory capture. Um, I think
It is
not only
like
did they capture it,
impressive.
they ate. Not only did they capture it, they ate the whole thing.
I know it's like it is objectively impressive, and like I'm also impressed how there haven't been like maybe there have been antitrust inquiries there, but like what the hell, right? Like that is objectively impressive.
Yeah, I mean, we just need HIEs and health data utilities. These are ultimately public goods, a term I rarely use because I'm a Milton Friedman kind of guy in the number of public goods, which you can count on about one hand, right? Defense, justice, the environment. Maybe there's a fourth one, some kind of social network thing, right? But it's not a lot. Um, but this sort of fits into that rubric, especially the way we pay for care. Um, you know, it'll modern computing will overwhelm this, right? These sort of narrow point solutions. We don't drive around in horse and buggies anymore. Modern computing will overwhelm this sort of a question of when.
That is a
but
very
governance remains
hopeful statement.
It does, but governance remains important for this, for things that are of a critical level of importance, like to that level that you say, Don, like the public good level.
Yeah.
Well, then you got to have some kind of governance, right? There's a reason why the air out here is clear right now, and you can say the EPA went too far, but you can also say the air is clear right here, and the water is technically drinkable.
And that's one of the things that Friedman outlined back in the 60s. So yes.
Yeah.
So Lisa, you're a Milton Friedman kind of person. You may not have known
Silent
that.
Spring, baby. Silver Spring, Maryland.
Intuited it. You could read the rest of the book, Capitalism and Freedom, to see if there's any gaps in your understanding.
Oh my God. Oh my God.
This is amazing. I'm going to totally take this book report. Very excited about it. Loving it so much. Channeling my own family. Got it.
Okay, I agree. I think that we should just get all the pharmacies connected to all the HIEs. I think we should just bypass that bullshit. Okay, Don. What is the parting thoughts for our loyal fans and ideal takeaways other than that RAG is the future?
I think people need to really think about APIs in their lives. Ryan Howell has made this point. I think maybe Anish has, I don't know. But the modern digital economy is based on application programming interfaces, not quixotic, security things or
internet infrastructure. We need more of that.
Yeah.
It's robust public key cryptography security, if you're doing business and you're not thinking about your business in the API world, then maybe you should go to Amazon.com and ask yourself, the last time you bought some kind of thing you wouldn't need, how many APIs were involved? This is like, where's Waldo? This is an exercise for the reader, as they say in physics textbooks, right? Exercise for the reader. Go to Amazon.com, look at the last thing you ordered, and ask yourself from the entire supply chain, the entire shipping chain, the stocking chain, the payment chain, how many APIs there were. That's how we need to think about healthcare if we're actually going to change healthcare. That's the parting thought.
Awesome.
Boom.
Thank
All
you,
right.
Don.
Well, Dr. Donald Rucker, former national coordinator, sign on
no
the free
matter
markets.
where you graduated in med school, still great.
That's right. We're gonna have our transition slide here. Thank you for joining our show. All right. Now
and I'm looking forward to hearing Jonathan. So
we'll see what happens.
Pleasure for me coming up.
John, push. John, on a boat.
So how's the boat? Where are you?
Boat's amazing. The boat is, we're all checking our life jackets and getting ready to go straight to Maine after this. We're in Florida. Amazing. We're trying to get the boat to where God summers, which is in Maine.
Amazing. I wish it would be even better, although probably difficult from a connectivity perspective, if you were actually on in
we
transit
should have
right
done this
now,
tomorrow.
Like,
no, I've got.
Oh my God.
Elon Musk. I've got Elon Marine on the back. So
Elon Marine.
No one at Zeus, until you guys ruined it, no one at Zeus knew that I was playing hooky.
Oh my God.
Because I was going to be on all my
I feel like it's fine. Hey, so listen, so from what we hear, you're still like defending the small practice. Like, what's the story there?
Well, I think you've been talking about the value of markets. So in general, many buyers and many sellers with freedom to move about and jostle is where most innovation happens. Now, of course, at the end of the jostle, people get tired and settle, and there are winners. And as Karl Marx taught us, as a Bush, we're required to quote Karl Marx at least once a week. But what Marx didn't know is that the winner, that monopolist, eventually becomes obsolete and weird and kind of falls over. And
That's what I'm talking about.
Jostlers. There's a bunch of potato bugs underneath the rocks that are, making the next thing. So
interesting.
I think that's true of anything for which there is potential energy. In other words, for which there is appetite. And I think we'll see that in this space. In fact, in Don's dream of a healthcare API world, the fact that people have made so much money on Medicare Advantage, the fact that next it's no longer going to be made on upcoding, correct illness diagnosing
assessment,
people,
risk adjustment,
adjusting for necessary risk. But in fact, by, I don't know, maybe coordinating the care of people, that's going to demand the idea of being able to be in lots of EMRs, the idea of being able to get lots of data from lots of places, the idea of actually giving a shit whether the data you got was complete or not. That's expensive. That shit is an expensive shit to give.
Yes.
So
yes,
there has to be money to be made for somebody to go and proofread. Like, lots of people do lots of calling against claims that are still outstanding. They know how many they sent. They know how many came back. They know how much they expected. Athena had a whole life in that world. Nobody has ever called on their missing discharge summaries. And yet, even when you do get an ADT, tons of them are missing discharge summaries. Now they'll call. I mean, I suppose the Chen family's been calling. Where's my, there's some people that have really made money on Medicare Advantage that are driving these things that actually probably have been calling, but it's not the norm. And as they do, demanding more supple, more responsive, more always on pathways will create a path for them.
Yeah, it's interesting. We hear a lot of complaints, and now that Zeus is in this business and building up the business, we hear people say, "Well, why are they charging so much for this data set, for this value?" And I'm like, they probably should charge more, but you should be concerned that it is like extremely high quality and complete, right? You need to pay for actual value of data delivered.
Right.
And there needs to be some way to be like, hey, this should be more complete or higher quality or more adherent to standards or whatever it is, right? Like, probably it should cost more.
Yeah.
I don't know.
No, when I was raising money for Zeus, a great investor, informaticist investor, sort of took me aside, like maybe I had, drunkenly fallen in the punch bowl at the wedding and was like going to say, like, listen, and she was like, listen, I respect you, you're a great person, you've done great things. Just tell me you're not really going to get people to pay for clinical information, because you'll fail. I'll give you $100 million to do something with billing. Just move over to payment. Why are you? Please, you're crazy. You're such a good guy, and you're going to end on a fail. And this is a really smart person. I still carry it around. I don't know if I tore my rotator cuff or if the chip that's been sitting here ever since. And because she might be right. Well, right.
Yeah.
And so, what I imagine is that, as everyone knows, the potential of actually knowing the truth all the time about a patient for money to be made is vast. We are easily paying for 2 entire healthcare systems. We're easily doing everything we do for a patient twice. Right. We're easily spending 50% of a doctor's day on duplication of shit that some other doctor did some other day, not too long ago. So we know, but how do you get the jobs to do? How do you get the stories to flow that actually harvest that money, right? It's a long road. First, you got to have the stem cell. You got to have that. You got to have the record exist and be reliable enough that it's not just a better deal to give the patient a clipboard again, right? You actually have to believe the data, and it's got to be complete enough in a world where no one's ever worked on it. So it's no matter which HIE, government thing, TEFCA, APIs, and everybody's hospital, fire service, none of them work until you work them and hone them, right? So whichever one, fine, or a panoply of them, who gives a shit? What we need is,
100%.
and so what Zeus has been doing is building that stem cell, at a loss, but building out all the pieces so that the enrichment is there, all the codes are there, the shit that's missing is known to be missing, and we chase it down and get it. And then we start to do little fledgling stories. Hey, when you text your friend in WhatsApp, you see that they read it. And when they're writing back, you can see they're writing in real time. When you refer a patient to a critical specialist, you have no clue whether, if, when, and what happened in the moment. What if that was real time also, right? But in order to do that, you've got to have something useful to send to the specialist in the first place, right? Then you can start to see some sort of living, breathing alternative reality to everybody's little silo. And so the reason we're so cheap is that we're desperate. No, the reason that we're so cheap is that we're building out a stem cell that, as we build more things upon, will hopefully get more valuable, and we'll get a little piece, because I'm a peaceful person.
Yeah.
A little piece of everything.
Yeah. So a little peaceful.
I love that. Peaceful person. Yeah, Lisa and I talk about this a lot. Like, a lot of people think like the end game is just getting the data to flow, but like the truth is, like, a lot of the data that's flowing is like trash data. Like, it's like total bullshit.
And it also just flows into the garbage. It flows
honestly,
into the sea.
When I started Zeus, I was like, okay, so we'll go get the data, because that's all free and available now, and then we'll start building out little jobs to do, right? Little workflows. Oh, you want to build a patient app? Grab our API. Oh, you want to do a CRM? Grab our API. Oh, you want to have your own EMR only for otolaryngologists? Grab our API. And then we realize the data is shite, missing, and when we get it together, it's 90% duplicated, and there's codes missing. And so it ended up that the first 3 years of Zeus was nothing but enrichment, cleansing, and finding gaps. Now we got our first little baby workflows coming out of the womb and crawling out of the turtle beach kind of, I don't know, the ocean. Is that a metaphor?
Sure.
It's really interesting, even when the government steps in and says, fatwa on those who do not share their data, and everybody must, and everybody's got an HI. It's still, until you've been using it, no matter what, it's going to be shit. And it's a lot of work to use it until it's machined into not shit.
But Jonathan, this is the thing. This is one of the reasons why we agree on a lot of things as well. Paradoxically, I might say.
Are you still a socialist?
No, I mean, Jonathan Bush, Don Rucker are for sure.
I feel like I have rubbed off on you
on a similar wavelength to me on many ways. The workflow is so important. We should move more data. Like we were saying, we've got to move more data, but it doesn't
until you have a job to do with the data, and until the data does the job. Data's not going to be worth much. You got it.
I agree.
You fellow capitalists, you are crushing it.
That's what I'm talking about. Yeah, I'm here for it. So yeah, like that's I love your opening statement that like, oh yeah, we'll go get the data. It's like all free and easy to get. Yeah. Well, I know your PR team probably would appreciate it if we asked you about the national networks, but what else do you want to tell us about?
Honestly, I think the thing to do about all these are all everybody's best efforts at moving the data, right? And in the beginning, it was like, we should move the data because in public health policy class, we thought about all the things that might be better if that were true, and agreed, and also probably don't eat meat, and also write poems. But the way things move, the way you take potential and turn it into kinetic energy is, there's a capitalist driver there. And so whichever of these networks, whichever of their standards, if you don't give it to us in fire, we'll map it. The key is to find jobs to do. And, the thing I think that was odd, it was great. I sort of accepted that Medicare Advantage was getting a 15% premium over straight Medicare in the beginning, which seemed sort of anti-capitalist. Should be a discount, right? But it's like Keynesianism. It's priming the pump. And like all these ridiculous coding games that everyone's playing, at least it's making them use the data. Now, they're mostly using claims data, but at least they're using some data. They're going back and looking it over. They're picking it over, and it's cleaning up, right? Now it's like, well, gee, I played that out. A star is impossible to get because everybody's driving all the stars up to the edge of the earth. But I haven't even begun to look at the clinical data, and there's all kinds of interesting crossovers. I'm really good at getting my eligibility data for my fee-for-service claims if I get an eligibility message that Betty's going to a cardiologist that I didn't refer her to, and I'm trying to manage Betty's care, that's some really interesting clinical information, right?
It is.
I didn't know that.
So it's like that we're good at anything with data is good. And now we'll, evolve into clinical data, and then we'll evolve into real-time clinical data. I imagine eventually these institutions, either go the way of the dodo bird or evolve, and become, pigeons or useful birds that can live in Central Park. But all of that has everything to do with there being a sucking sound on the other side saying, I need this. I need this,
Right.
and I need it now, and I need it to be clean, and I need to invest in its cleanliness.
Yeah.
But I feel like we've all been trying to expand the market. I think we're making some progress, but I keep going like, where is that tipping point where it gets too freaking expensive, where they say it's just too much money for us to be ignoring all this data? Like, are we there yet?
Every
Jonathan,
day.
Are we there yet?
Every day I have a meeting and I'm like, fuck, I'm too late. I missed it. And then the next day I'm like, oh shit, we're way too early.
We're not there. We're not there yet.
We gotta wait till the appetite builds more, And then some
Right.
days, like today, I just had a great meeting. I'm like, you know what? I think we're dead on balls accurate. Right now is the time. But it really depends on the last 3 meetings. Yeah.
Oh,
Yeah.
all right. Hey, okay. So listen,
I think you're absolutely right. Until people start making money with really good data, I mean, you can use it a million ways. I mean, you're in urgent care. You spend 20 minutes just clipboarding someone. If you could press a button and the clipboards are all full and you go right into it, you're a capitated primary care and you want to get a better deal from your urgent care. You say, hey, I'll zap you everything. You don't need to worry about it all. And how about this? If you update your record if your record's connected, the second you're done, I'll Venmo you. You don't have to bill. My ledger will update the minute you update the shared chart. Like now that's money. It's $8 PM to play the claim game. Like if there's $8 PM in play, we're going to clean up our data lickety splickety.
Wait, are you getting into the billing business or what?
Yeah, did you just go to revenue cycle?
Did you go straight to
I keep thinking about that. I keep thinking about that woman. I'm like, maybe I am in the billing. Maybe I am. Don't give up on me.
I think you can just merge it together. It's all really the same at the end of the day anyway. Okay, I have like a industry question for you. Okay, so you guys are still you're still doing ambulatory stuff, right? I know bigger practices, but still like ambulatory practices, right? Is what Zeus is up to. Yes.
Well, Zeus is, there's two kinds of customers, right? There's at-risk provider entities who actually get paid to know where their patients are and their state. And then it's receivers of or people interested in at-risk providers entities. So the other side of the telephone line from at-risk provider entities. So some of those could be facilities, but most of them today are either virtual or ambulatory.
Okay. So what do you think about all the market consolidation with, like people are just gobbling up these independent practices? There's like, what do you is that good? Is that bad? Like, how do you feel about that as a member of the Bush family?
I hate to, it's bad when I quote Karl Marx twice in one day, let alone once a week. But look, it's the dinosaurs mating. The idea that you have to take your take a day off of work, wait in line, do a clipboard, sit on cold wax paper over linoleum tile, take your pants off to talk to the doctor for 12 seconds is an obsolete concept, right? So if they all merge and just do that shit with lower overhead, great. They're making room in the evolutionary chain for people who will do that virtually in real time for you all the time, right? The average person sees their primary care doctor once every 18 months or so. The average Firefly member sees their primary care doctor 37 times a year, right? Now it's at a red light,
really?
It's 12. Yeah, they just, every time something bothers them, they go in and out. So Firefly's likelihood of knowing when somebody's about to hit the emergency room or the hospital or a specialist is way higher than the primary care doctor who's lying around with his bone densitometry machine and his pap smear and is trying to get his procedure codes up on the once every 18 months that someone shows up.
Risk adjustment. That's risk adjustment.
If any established sort of not evolving any further mode of operating consolidates, good. If it wasn't for the fact of evolution, I would be terrified and I'd break them up again, make the government come in. But if the whole concept is kind of sinking into the earth and about to turn into a fossil, so what? They sink into the earth as one thing as opposed to 30 things fighting on their way into the earth. As long as evolution continues, as long as there's somebody eating the lunch, as long as the hospitals can all merge, great. As long as there's urgent cares and ambulatory surgical centers and really good drugs eating the lunch of those hospitals, great. And then drug companies, they can merge as long as there's biotech companies killing their 12 big dumb drugs, and primary cares or specialists can all merge as long as there's less invasive robotic alternatives eating their lunch. But you have to have that entire circle of life going to not freak out when there's consolidation.
Yeah, see, this show is so hard for me.
You said potato bugs. You said potato bugs.
This show is so.
I'm terrified of those.
We'll all blow ourselves up, and potato bugs will be sitting in my sailboat, navigating. Yeah,
potato bugs.
Potato bugs are relatively harmless.
They will. That's what you say now. Come back in a couple millennia, we'll see.
We will see what happens. Okay, so this show has been kind of hard for me because I agree with everybody. This is like my show. So it's been hard. So I'm not getting any fights, but let me try to get in a little bit of a fight. Okay, so that's great. This evolution thing is great. I totally agree. But let's talk about access for the underserved, right?
Sure.
So this whole evolution is great, and long term, people like me, we can do the firefly, right? We can do all those things. But what about people who don't have who can't do those things? Where does that end out?
Well, it's so ironic, right? I mean,
look at me trying, Lisa. I'm trying to be left of center.
Speaking, who's more likely to be able to take a day off work, take an Uber, wait in line? The Richies, right? But guess who's left doing it? They're not Richies. The fact of the matter is, those virtual models, while they may be piloted on the well-heeled, self-insured employee types, they're vastly more useful and applicable to people with mobility issues. Rural settings, urban settings, no car, no shift work, not allowed to take time during the workday without looking like a juicy target for a layoff. All those people are the ones that are going to benefit the most from the next generation, from the virtualization and the mass customization. It's just that they're not the ones who can pay for it when it's inefficient, sloppy, and covered up by extra service. That's us. And then eventually it gets normalized and cleaned up with us. And then but we've got, I don't know, out of 55 customers, 5 Medicaid providers, straight Medicaid, just doing break your heart open good work that they, and everything they do is virtual first because they can't afford at Medicaid rates to do it the way the FQHCs and all these other people, these lovely but kind of gappy in terms of their service experience, established approaches have done it for years. It's already happening. It's already happening that those kinds of always on, mostly automated, intelligent AWACS overflyers are getting into the areas of greatest need because guess what? Those areas have the highest hospitalization rates because they're not getting the care they need.
Yeah.
So you can make if you make money cutting hospital days, Medicaid's a great place to look.
Yeah.
See, right.
It's not
all right.
It's not working, Kat. We agree. We agree with too many of these things.
You agree again. I'm sorry.
I know. I mean, this is the best for me, but maybe also the worst because I'm not getting in any fights. Okay, Jonathan, what is the thing you think is the most bullshit right now in the healthcare industry? Because we've got 2 more minutes for you to tell us your big feelings.
Jesus Christ.
What's bullshit? Or you can tell us what you think of PBMs, not PDMPs, PBMs.
Maybe PBMs are the most bullshit in the healthcare industry. Maybe that's 2 answers. Maybe you're leading the witness, because PBMs are pretty fucked up themselves. That's an example of the dinosaurs mating and hopefully sinking into the earth and becoming fossils, and letting the good RXs or the unbundlers. I mean, the discount on a $4 generic drug that at PBM, who cares what discount it is? Let's say it's a 50% discount, and so it's $2 instead of $4. The list price is so low, frankly, we should probably raise the prices of those drugs so that the Israelis will keep making them, and we can have them. The problem is this: the guy who's been convinced, a la your Practice Fusion episode or the miniskirt delivering sandwich person or the whatever, to choose a gourmet drug when a generic one is vastly better. Hey, look at the great price I got. I'll never forget the first time I talked to Jay Alex of Jay Alex Associates. He was describing the turnaround of digital equipment. And he was like, I'm in here to get cash and save the company. I'm going around. I see 4 helicopters. Put them on the market. And the CFO comes running and he says, what are you doing selling the helicopters? We got a great deal on those. On helicopters? So what? Sell them. Who cares? And it's so PBM saying, I got a great deal on a $200,000 drug you don't need. Oh, thanks a lot. How about I don't use the 200? How about I do some sit-ups?
That's right.
Or whatever. But that is not that is one of those examples where you hope that the discount monopolists do their thing, do their merging, make their money, and sort of fade out as the intelligent front ends that redirect prescription behavior and fulfillment behavior kind of rise to the fore.
Shout out to Photon.
Oh my
when was
God.
the last time you saw, Photon, Capital RX? There are, I think they call themselves PBM, but they're really represcribers. They have the ovaries to get in there and say, you know what? I know he did that, but let's all agree that we should try this one first.
We're just not going to do that. Yeah, we're just going to do something else.
We're not going to do that. Right. Yeah. Okay. All right. So I'm going to bring Don back on the screen here. What did we learn, dear audience? Today we learned that cloud computing will take over American healthcare and save us all. And we also learned that the dinosaurs will continue to mate until the bad guys just crumble into the ground. So this is like the best. I'm sorry I did not get in any fights, but I feel
I just want to say they're not bad. Dinosaurs are not bad. They're beautiful, big. They just can't graze anymore. They ate all the grass. And that's okay. They're beautiful, and we'll have cartoons about them.
Your time is done. It's over.
Sorry.
The dinosaurs' time is over.
Yes.
We're moving on.
That's right. Well,
That's right.
we need that
That's what
huge
you're
meteor. That's what we need is the meteor.
Well, there's always the Department of Justice meteor as opposed to just the evolutionary fade. Either one.
It's amazing. Well, and you could say, I know the history of the names of your companies, but I think it was Zeus that had the lightning strike, right? The big, that Zeus feels like it might be well positioned to be part of that meteor.
Well, also Athena's daddy, but not for nothing.
Okay. This is amazing. You guys are great. We very much appreciate you. We wish we could get in more fights with you, but we agree with you on too many things.
Yeah, it's a problem. Next time, I'll come up with some fights next time. Well, thank you, Jonathan. I hope you make it to Maine. I hope.
Thank you, Jonathan.
We will make it. Everybody, you'll all end up in Maine eventually. Don't worry. I'll be there next week. You'll be there when the global warming, scoops you up.
Perfect.
I'll see you guys.
And Don, enjoy Crystal City.
Glad you had the power again. Bye, everyone. Happy Memorial Day.
Bye,
Remember